In this video, we're gonna talk about the OSCE in Australia for the registration process. So let's start. Hey, this is Rima and welcome back to my channel. So before moving forward, I would just like to let you know I have also passed my Bachelor's of Science in Nursing from Nepal, and I completed my Master's of Nursing in Professional Studies from Western Sydney University here in Australia. I have got registration for both Nepal and Australia. For Australia, I give NCLEX and OSCE to receive my registration. So if you are interested, please let's move forward with the video. Disclaimer, this is based on my personal experience, how I passed my OSCE. Chapter 1. What is OSCE? So OSCE, it is an objective structured question where you have to show your skills and knowledge based on the scenarios given in the examination. This is the second step after passing the NCLEX examination to get the registration as an RN in Australia. In the OSCE, only the clinical skill is not measured. There are many other factors that will be examined in this process. Handbook contains the information about the clinical skill and the knowledge level that a candidate should possess. You can find this handbook once you pass your NCLEX examination. NMBA, Nursing Midwifery Australian Board, will send you an email with congratulations and attached OSCE handbook in the email. If you want to find it early before you pass the NCLEX exam, then you can go in the Google to find it. So let's move how to find it in the Google. Alright guys, let's go in Google. Type NMBA Australia. So once you type in, it will come up with all the choices. You go down. So under NMBA, you will see internationally qualified nurses. Go under internationally qualified nurses. So once you go there, you will see more choices. Click on the examination section where it will come up with the NCLEX and OSCE. So you press on that OSCE. You can check on down as well, but you can press on that OSCE and then it will come up with more choices such as enrolled nurse or registered nurse or midwifery. Since we are doing the registered nurse, press on the registered nurses. So once you go down, there will be more choices, MCQ and OSCE. So under the OSCE, there will be the candidate handbook. Press on that one and then you can see it's downloading. So once it's downloaded, under this OSCE handbook, you will see so many things such as clinical skills you need, the environment, the thing, everything is inside it. So have a look. When you are preparing for your OSCE, you need to get familiar with the Australian standards, policies and procedures in its healthcare system. You can find these standards online in Google as well. If you have joined any organization, then they can also provide you these standards. An institute or preparation class will help you for the easy access of the equipments that you may be needing in practicing your all the skills, such as vital sign equipments, mannequin for the CPRs, dressing equipments, and also medication equipment. While you are practicing for your OSCE examination, you should familiarize yourself with the forms and charts that are used in the Australia for any kind of procedures, such as pressure injury assessment, fall risk assessment, or vital signs chart, neurovascular, neurological charts, and furthermore. Similarly, when you are practicing in the preparation class, there will be lots of people like you who are practicing. It will help you to find your peer and which will help you to further identify your areas to be improved and your strength. However, if you are not going in the preparation class, then you can also find out these by recording your video by yourself while you are practicing and going through your videos. It is not compulsory for you to join the preparation class, but from my experience, it really helped me to identify my weakness and my strength. So I would suggest to join a preparation class, even you have lots of experience in overseas country. Chapter 2. How to prepare for your OSCE. By now, you must be well aware that you will be given total 10 minutes for the whole examination. Out of 10 minutes, 2 minutes will be reading question, and 8 minutes will be to perform your skill. The most difficult part in the OSCE is time management. Therefore, I suggest prepare beforehand. You can divide your total 8 minutes of time in such a way, such as start from environment check, give introduction, explain about the procedure, take consent, the ID band check, give privacy, perform your skill, documentation, and conclusion. Remember, you can only save your time in environment check, introduction, and conclusion, as we cannot compromise the clinical skill. When you do the environment check, you do not have to explain all those things that are in your environment, such as any particular hazards or anything. Just be straightforward. For example, upon entering my patient room, I can see there is no any danger. My patient is on standard precaution. That's all. But if your patient is on any kind of precaution, such as contact precaution, then you can say, upon entering my patient room, I can see there is no any danger. My patient is on contact precaution, so I'll be wearing the gown and gloves. That's all. Okay. For your introduction part, you do not have to go through all your introduction. You can just say, hi, my name is Rima. I am one of the nurse looking after you today. How are you? That's it. You do not have to say, look, my name is Rima, I'm registered nurse, today here, how are you, and blah, blah, blah. No need to hesitate. And after that, explain about the procedure and take consent. So you will say why you are there. I'm here to do your pain assessment. Is it okay if we do it now? Anything. And they will say yes, let's do it. After they say yes, then you can say, let's start with the ID band check. So in ID band check, ask if they have any allergies. Can you tell me your full name and date of birth? And then you check their MRN number against your file. Once you do that, provide the privacy to the patient and tell them you're gonna start your skill. Doing your clinical skill, if there is anything that you want to give the instruction, then you can go with the flow, or you can, if there's something that must be done before ahead, then you can quickly say it and start doing it and talk. Do not waste your time. And then if there's something that you will need to document side by side, then you can do your skill and also document side by side. And don't give more than 1 or 2 minutes for documentation. Documentation, practice it while you are doing your clinical skill at home. It will help you to write documentation quickly. If you are confused while you are giving anything in between the exam, don't be hesitant to ask. Ask immediately. Don't waste your time. In conclusion, the main thing is about thanking the patient and giving the few health education. That's all. There's nothing more that you need to include. If you get time, then you can talk through about the day, about the result, about the skill that you just did, or about any recommendations or anything like that. If you want to share the result, you can share it between the clinical skill that you are doing, or you can also if you get more time at the end, then you can explain it to your patient. Or suppose you did the blood pressure, you say, oh, your blood pressure is good. You do the heart rate, you say your heart rate is normal, it's between the flags, something like that. You do not have to save it for the conclusion. Okay. Chapter 4, things to keep in mind. Things to remember. Number 1, use good non-verbal communication skill as well. Don't forget about the communication skill. It will also be measured during your examination. So use your non-verbal communication cues, such as give the smile, use your hand gestures while you are talking, and be calm. Next is be particular, don't be vague. Don't hesitate and don't mumble. While you practice your clinical skill, you need to practice more and more. So your fluency will be good. And last, wear scrub. Look smart. Okay, it will also help you to increase your confidence. And that's all. Thank you for watching the video until the end. If you like this video, please do like, comment and subscribe, and share this video with your friends as well. If you have any further more questions, you can put in the comment box. Thank you so much.